Hi, my name is Jennifer Lockwood, and I am the CEO and founder of Ravin Consultants. I founded Ravin Consultants in 2017 after learning and cracking the code of what's called the 340B drug discount program. And after being there for 7 years with that organization, I decided it was time to take that vision and mission and spread it along all the other organizations in the United States of America. We take over the 340B program so our clients can take over taking care of their patients. What really matters to them is their mission and vision of taking care of their patients. So we take care of the compliance and optimization of the 340B program.
I'm Lauren Navis, Chief Marketing Officer at Ravin Consultants. I've been here for over 5 years and have really seen astronomical growth in this company. I can't even believe how much we've grown over the years. It's truly phenomenal. I apply the same principles I learned at companies like Colgate-Palmolive to Ravin Consultants, not just for us internally, but for our clients as well. And we really help them grow their healthcare organizations and reach more clients and make a meaningful impact.
My name is Joy Winheim, and I'm the president of Epic. Epic is a member of Empath Health, and we provide supportive services to the Tampa Bay community. I think rather than one success story, it's better to talk about the many success stories. We have reinvested over $175,000 into emergency rent, mortgage, and utility programs to keep clients in housing. These are clients that would otherwise have been evicted or had their power shut off, which means they can't keep their medication stored properly, which means then they wouldn't be adherent to their medications, which could cause another whole host of health problems. So we've been able to purchase insurance for clients that were uninsured and enable them to access primary medical care. So we have more success stories than we would have if we were not working with Ravin. Ravin has helped us maximize our savings. They've helped us increase compliance with HRSA regulations by working with our team to make sure that we understand the 340B program in and out.
Hi, my name is Nicole White, and I'm a board-certified family nurse practitioner. I work for Epic Sexual Health Center, and I provide testing and treatment services to our patients, including gynecological care, PrEP services, and STD testing. 340B program allows for expansions of these services to our patients. The funding that Epic receives allows us to pass cost savings on to our patients for STD testing and treatment services for patients who otherwise wouldn't be able to afford it. So we had a specific patient who was HIV negative, and she was with an HIV positive partner. They had sexual intercourse, and the condom broke during intercourse. Unfortunately, at the time, the patient only had Medicaid insurance, and they had to go to direct pharmacies, who was not able to get her the medication that she required, called NPEP. The medication is required within 72 hours. She came to our pharmacy. We were able to get that medication for her. Sometimes that medication can cost upwards of $1,500. We were able to get it to her for free and within the 72-hour period so we could protect her health.
My favorite story at Ravin Consultants is for sure our first client. Our first client is based in Orlando and did not have the 340B program implemented. They were in a dilapidated building. They were losing funds left and right, were on the brink of bankruptcy or dissolution. And she allowed me to come in as a brand new company and help her. And to this day, now she bought a beautiful new building, has quadrupled in staff, has patient assistant programs, has transportation programs, has everything that she needed for her vision and mission of her organization. And not only did she help everyone around her in her community, she helped build Ravin Consultants as well. With my accounting background, it's very complicated to reconcile and consolidate the 340B program. In this program, you use multiple third-party administrators, TPAs. So every time you want to run a report, you have to run multiple consolidated reports. I couldn't stand that, because if you come to me and ask me one day for something, I have to go and format every single one of those spreadsheets. It became way too time-consuming. So we built what's called the dashboard here at Ravin Consultants. It takes every single feed from the TPAs, consolidates it, reconciles everything with the contracts that we have in place, and we're able to look at the key points of interest, KPIs. We can look at month over month, provider over provider, manufacturer's restrictions. We could look at capture referral. Anything that's going to optimize your program, we're able to see in a single snapshot.
I'm Rob Ferraro. I'm our Chief Operating Officer and Principal. I oversee all client operations. I make sure our staff is happy. I make sure our clients are happy. Our proprietary dashboard provides robust data analytics that empower healthcare organizations to monitor their 340B programs more effectively. The dashboard offers covered entities a consolidated view of their 340B claims data across all pharmacies and third-party administrators. With the recent implementation of various manufacturer restrictions, we added the capability to monitor each manufacturer's impact on a covered entity's program. Wholesaler pricing verification can now be done at a glance, giving clients the peace of mind that they're not overpaying for 340B medications. By offering insights into capture rate, medication utilization, compliance, and financial performance, the dashboard allows organizations to make data-driven decisions, ensuring they maximize their savings and reduce waste. Lean certified processes focus on eliminating waste and optimizing workflows. By streamlining operations, we help our clients reduce inefficiencies and improve their resource utilization, and ultimately provide better care at lower costs. This approach leads to faster turnaround times and higher satisfaction for both staff and patients. In the 340B world specifically, it helps to obtain standard workflows for patient definition, prescription capture, eligibility verification, replenishment logic. We're also using lean processes in Ravin's own operations. Increasing the efficiency of our internal workflows allows us to spend more time to focus on our clients and their needs.
The dashboard is the best solution for your 340B program management. It aligns 340B with accounting and financial forecasting, so it allows you to optimize your 340B program and operate it the way that it should be.
The 340B program bridges these healthcare disparities by ensuring that nobody has to choose between financial stability and their well-being.
What does it mean to be part of a 100% woman-owned business? It means everything. It's so meaningful to come here every day, to be surrounded by women who truly support women, who try to lift each other up, inspire each other, support each other, help each other grow. I'm just so lucky to be part of a company like this, and it really feels like a family of people you trust.
The partnership that we have with Ravin Consultants allows us to reach communities that are vulnerable that we otherwise wouldn't be able to reach, providing the same quality care to these communities as those who have the monetary means to do so.
Ravin Consultants stands out because of our unique combination of data-driven tools, lean processes, and deep industry expertise. Our team is made up of exceptional individuals, most of whom are doctorate and master's level executives, and all of whom bring a diverse wealth of 340B experience.
My hopes for the future of our partnership with Ravin is that we are going to continue to maximize our savings. We're going to be able to reinvest in programs that grants don't fund. We're going to be able to help as many patients in the Tampa Bay community as we can, and also that they are going to help us become the premier experts on 340B and that they'll work themselves out of a job.
The future of Ravin is to continue growing, because if I have more Ravineers, that means we have more clients. If we have more clients, that means more patients are being served in the communities. So continue growing. Absolutely 100% is to continue growing, learning optimization even better, making our efficiencies even better, learning to teach our clients better. Because again, if we're growing, that means our clients are growing. That means the patients are getting more assistance. Our goal with the 340B program is to protect it. It needs to be protected at this point. It's been around since 1992. It was revamped in 2010. It is bipartisan, but we must protect it. It is pivotal for these organizations to have this program. For some, it's the only one that comes in on time and is unrestricted. They can use it on anything that they feel they need to. Protecting the 340B program is by far the biggest goal for the Ravineers. Ravin Consultants works with hospitals and local healthcare organizations to optimize their 340B program with 100% compliance. We also assist with practice administration, credentialing, accounting, human resources, marketing, anything that's going to continue driving your organization forward.